Aging, testosterone, estrogen, buzzwords you hear everywhere. Buckle up, this conversation will shift your perspective. It can genuinely change your life like it did mine. Welcome to Truth on Tilt. Dr. Setarah, welcome, my man.
Thank you. Thanks for having me.
You're looking all tanned. I heard you just got back from Hawaii.
Last night.
Mm-hmm. Well, welcome to the studio.
Thank you.
Yeah.
Thank you. I feel great. I'm happy, relaxed.
Good. Did you get good mindfulness while you were there?
Oh, dude, I feel like a new person. Actually, 10 days is it's the longest vacation I've taken in a long time.
Yeah. Well, how long you been in practice?
2019, so 6 years.
6 years.
Yeah.
And then you did 4 years of medical school, 1 year of internship, and 3 years of residency?
A 3-year residency I did. So, plus a couple years in between for research and, just life.
Just life?
Yeah.
Oh, you actually had a little break between school and actually practicing?
Yeah. So after medical school and before residency, I did research in New York at Queens Hospital. And at the same time, I had this job working for this pharmacy, which was actually like a spectacular kind of window in my life. I was making like pretty good money, especially compared to, what I would have made in residency or anything. I was working very little, plus doing the research on the side. And I had a great kind of time living in New York as just a young dude.
Yeah. New York as a young dude, as a doctor, because that's a great pickup line. I'm a doctor. Right? It doesn't hurt. It doesn't hurt.
It doesn't hurt. No.
Yeah, it works better than I'm a plumber. Or even better, I work for the IRS. That one wouldn't work.
The funny thing is, at that age, if you're a plumber, you probably have way more money than any doctor at that age.
Yeah. What got you out here to California?
I'm from California. I was actually born in New York, but I grew up in LA. I lived there until college. I went to San Diego State for college, then was all around for medical school and residency. I was in the Caribbean for a couple years, New York for a couple years, Miami for a couple years, back to New York for my first year of residency, then to University of Arizona in Tucson for the rest of my residency. And also that's where I got my degree in integrative medicine, the Andrew Weil Center for Integrative Medicine. It's kind of like the hub for integrative medicine. So I got kind of trained in that. That opened my eyes to a lot of the stuff that I do now. It didn't actually train me specifically for almost any of the things. I shouldn't say that because I do a lot of supplements and lab work and stuff. But the bulk of what I do, the hormones, the wellness, that sort of stuff, you can't really learn that in residency. So I learned most of that after residency. But I do credit it for kind of opening my eyes to all of this.
What do you say to doctors who say integrative medicine is, I'll use a medical term, wacky?
I think they don't understand the definition of integrative medicine. So integrative medicine is it takes from Eastern and Western, right, allopathic medicine, it takes what has been scientifically proven with data to work and integrates them together, right? So this is not taking like homeopathic medications and things of that nature. This is all stuff that has evidence and data to work, wherever it comes from. So I use everything from antibiotics to yoga to help treat my patients. And what that does is it allows me to use what has the least side effects and what works the fastest in this complete range of medicine now that I have. So saying that it's wacky would just be showing me that you don't really understand what integrative medicine is.
Yeah, I had the same problem in veterinary medicine. A lot of people look at the ones who do a lot of Eastern medicine as, out of touch. I use the word wacky so people can understand.
Sure.
Understand it. But like, I was using integrative medicine in my practice as well, in veterinary medicine, because it's all about quality of life.
Mm-hmm.
And even in human medicine, I know you're not allowed to use that word as well as easily as we can in veterinary medicine.
It's changing, man. It's changing. I think a lot of my patients are in tune with it.
Yeah, right. But as a doctor, that's the way I've always looked. Maybe I was wrong. I've always looked as a medical professional on the human side. Your job is to keep that patient alive as long as possible.
Yeah.
Where my job working with the animals was just to make them as comfortable as I can for as long as I can.
Mm-hmm.
So when you talk about hormone replacement therapy, is it a buzzword or is it actually coming to the main front?
I would say it's probably one of the, I don't want to say most important, but probably one of the most impactful things in medicine right now. It's probably changing the most lives, and making the highest number of people live a higher quality of life than kind of anything that we got right now.
So for the listeners, how is it changing life?
So I guess we're breaking this down to men and women now, right? And a lot of women and a lot of men don't know that testosterone for women is like a huge thing right now. I think Oprah's doing a big thing on this right now. Actually, I just posted about it. It should be coming out soon, actually. Oprah's doing this whole like menopause kind of series, I think. And then she has these guests on that are doing hormones, women doing testosterone pellets, which is something that I specialize in. So let's, I guess, start with the women. For women, we typically do estrogen with testosterone and then some progesterone as well. The progesterone is just kind of like a safety thing. If you have a uterus and you're on estrogen, you need to be on progesterone for safety reasons. And we can get into that if you want, but we'll leave it until whenever you're ready for that. So the estrogen helps with a lot of things. So brain health, heart health, skin, that laxity in your skin, those fine lines. It puts the fullness back into your skin. Vaginal dryness can fix almost right away. The testosterone is more like the way you feel. You feel sharper, brighter, more energetic, more enthusiastic about the things that you used to enjoy doing. This goes for men and women. There's a term called anhedonia, meaning without pleasure. A lot of people think that low testosterone causes you to have depression, and that's not really true. It's the lack of enjoyment in the things that you used to do. So that guy that used to love hanging out with his friends or going out with his wife who'd rather stay home and watch TV. Same thing with women. Testosterone gives that back to you. You are like, oh man, I remember what life was like. I remember enjoying these things. My sex drive is way better. I'm way more enthusiastic about going out. I feel sharper. I feel better. I feel more just happier, an overall sense of well-being, right? You get all these things back when you get your testosterone back. So the testosterone that's kind of the same thing with men and women. With women, you get the benefit of getting that estrogen back as well.
Well, with men, people worry about that my testes are going to shrink and I'm going to get man boobs.
Okay.
Is that true?
Yes and no. Okay, so anytime you give a human a hormone that they were making, if you give it to them exogenously, meaning from an outside source, if I give you shots or pellets, your body's going to stop making it. So your testicles are like, why do we need to work if we don't need to? Your brain shuts down the signal that tells your testicles to keep working. So it's kind of like putting your left arm in a cast. If I put your arm in a cast, it's gonna start shrinking. Just like if I stop sending that message to your testes to stop working, they're also gonna start to shrink. I can take your left arm out of a cast in 4 weeks. It's gonna look smaller, but eventually it's gonna look like your right arm again, right?
Correct.
If I put you on testosterone, your testes are gonna shrink. 4 weeks later, if I take you off, they're gonna grow back. There is a limit to that, though. If I put your left arm in a cast for 6 months, is it ever gonna look like your right arm again? Probably not. You're probably always going to have some sort of loss, atrophy, loss of muscle, and dysfunction. Same thing with your testes. There are things that we can give you while you're on testosterone therapy, though, that mimic that signal that your brain sends to your testes, so your testes keep working while you're on this therapy.
So, again, you are my personal doctor.
Yes.
And I remember you giving me shit about the fact that my estrogen was higher than my wife's. Yep. And my testosterone was lower than my wife's.
Was it lower?
It was lower.
That's got to be pretty low.
It was. It was.
Okay.
It was in the hundreds. You're like, this is low, and I knew going in because I had done the anti-aging clinic probably 15 years prior,
Mm-hmm.
and that's why I was so excited when my wife is like, "Oh, he does hormone therapy, hormone replacement therapy." And I'm
Mm-hmm.
like, "He's my man."
Okay.
So, what made you come up with the treatment plan you did for me?
My treatment plans are very specific and tailored to my patients. This is something that I think we excel in at TrueMD. We uh, we build a plan that's very specific to you. A lot of other places you'll go, you'll see someone there who just kind of does the same thing for everyone. We're not like that. And for you, it must have been something very specific to like what you were telling me. So I tailor my plans based on your labs and your goals, right? Like, hey, I want to be able to go on this hike I got this guy right now actually who's pretty bad diabetic. It's caused him to have nephropathy, meaning kidney problems, and he's been pretty out of shape. And he wants to do this like 11-mile hike in Kauai, actually, ironically. And he's like, dude, you got to get me ready. And he has this trainer that I've taken care of. So the trainer sent him over to me. He can't take huge doses of protein because of his kidneys. You know, he's just got all these things. He's weak. He's working out hard. So our our whole goal for him is to get him ready for this hike. So my whole plan is tailored. We're doing like IV aminos, liquid aminos to help him kind of build muscle, even though he can't take these big doses of protein. We're doing a whole range of things that are very geared to him. So for you, and this was a while back now, but you know, your testosterone was really low, you're overweight, you were stressed out, you were kind of hating life at that moment, if I can say that.
Yeah,
Right.
absolutely.
Okay, you're kind of hating life. So our plan for you was to, you know, optimize your testosterone, get your weight down. We talked about some things in terms of stress and anxiety, which was, I think, kind of eating you up at that time. Honestly, I think if we'd just taken care of your stress and anxiety, you would have been like 75% of the way there. You were already kind of on a plan to do that on your own anyways, though.
Yeah, I was on my way to retire from
Yeah.
veterinary medicine.
Yeah.
I was looking for fulfillment, and that hence I was able to create this podcast studio here in Orange County, and which has been the most rewarding thing because I get to sit down and talk to experts like you about things that have helped me, and I hope will be able to help others. When it comes to women and hormone replacement therapy, I know the men listening will increase their sex drive.
Amazingly. Oprah actually talks a lot about this on that episode that I'm talking about. So women on testosterone actually is a treatment for, you know, hypoactive sexual disorder, but basically mean low libido, low sex drive for women. You give a woman a few months on testosterone and she feels like she did when she was 20. I mean, the number of women tend to come in sooner for treatment, right? Men like to wait forever. They do this for testosterone, they do this for weight, they do this for hair, and they do this for if they think they have something that's cancer. You know, they'll be like, I'm going to wait like 4 more months while I'm like bleeding every time I go to the bathroom or something like that, right? Women come in first, they get treated, their sex drive goes through the roof, they're feeling amazing, but their husband is still at home in that state of anhedonia, right? I don't want to do this, I don't want to do that, I don't want to go out with you, I don't want to have sex. Then women bring their husbands over their backs, like these like strong women coming in and bringing their husbands in. They're like, treat him. And probably the most fulfilling thing that I've ever done or that I kind of do regularly in medicine is making couples happy again, right? I got tons of couples. I mean, dozens and dozens of couples that are, you know, their kids moved out of the house. They've been in this state of like, who is this roommate that I'm living with? And now they're traveling together. They're having amazing sex. They're having a fun time. They've rekindled that kind of spark and they're just having a really, really good time together.
Yeah, I always feel as if I have one more that needs to leave for college. I'm looking forward to dating my spouse again. Maybe I should get her in. Maybe I should get her in and we check her out. But the problem was her testosterone was okay because she told me that you didn't really think that it would work for her. She's just an amazing woman who's very intelligent and also very stubborn
I
at the
can't
same
wait.
time.
I can't wait for her to see this episode.
I know. Yeah. Well, no, I know. I love my wife and she knows that.
Okay.
Yeah. But true, false question.
Yeah.
Hormone replacement therapy is only for old people.
No, false.
What's the youngest you've treated somebody?
I am on the conservative side for this. And I typically like for women to have gone through menopause and men to be at least in their 40s and done having kids. Have I treated younger? Definitely. There are cases where either, the men either have like some kind of disorder where they just need more testosterone, their life sucks without it, or they're 35 and they've had 2 or 3 kids and like, yo, I'm done having kids. I had a vasectomy and my testosterone sucks. I need help. For sure, I'll do that, And sometimes women, if they're kind of premenopausal, I'll give them just testosterone just to help with their sex drive, help them get back in the gym, help them function better. These, especially people that are working all day, meeting after meeting, testosterone gives you that nice confidence. Instead of feeling anxious about your meetings, you're like, okay, I'm ready to tackle this one. Next. And we didn't even talk about like the strength and endurance kind of portion of testosterone, right? Testosterone increases your red blood cells. You get more endurance. You get more stamina. You're able to ride a bike longer, run longer, have sex longer. You're able to lift heavier weights. Usually about 2 months into therapy, you notice someone who goes to the gym regularly will notice because they know what their limits are, and they'll start to surpass these limits. They're like, oh my God, I have another set, or I'll have like 2 more reps at the end of each set, or I'll have a little bit more weight on each set. And 2 months into it, you're like, this is nice. And you'll notice because your muscles will get bigger. You'll lose more fat because when you're building more muscle, right, your basal metabolic rate depends on how much muscle you have. How much energy does it take for you to just be alive every day? How many calories does that take? It's going to increase once you build your muscle, which means you're going to have less fat as well.
And if you're not losing fat while you're on testosterone, that's where it becomes important to look at what your estrogen levels are doing, correct?
Yes. Estrogen is not going to inhibit you from, you'll get that gynecomastia. We didn't talk about that. I'm sorry about that. Yeah. So you can, if your estrogen on a male is through the roof for a long period of time, you can get breast development. I've never had that happen to any of my patients because I track these markers like a hawk. And if you don't do your labs, I'm not going to give you any more testosterone because if you want to do it the way gym bros do it, you go ahead and do it like that. But if you're going to do it with me, we're going to track your labs. If your estrogen is too high for too long, you can start to get breast development. Yes, that's true, but it's never happened in my practice.
So what's the difference between these gym rats that do anabolic steroids and what you're doing with hormone replacement therapy?
Well, the first thing is, even if they're not doing like what we call anabolic steroids, because testosterone is an anabolic steroid.
Correct.
It's not highly anabolic like some of these other things that they're using, but it definitely is. I would say the big difference is tracking and dosing. So they will learn from their buddy in the gym. He'll be like, hey, do this many shots a week of this many milliliters and go live your life. They're not tracking anything. They're not tracking your testosterone level. They're not tracking your thickness of your blood, which is kind of the danger of doing too much testosterone. They're not tracking your estrogen level, which is why you see these super fit, super jacked young guys who have like a little bit of like breast buds. You're like, what's going on here? You look so fit, you look so strong. You're doing like 30 pull-ups and this and that, but you still have breast development. Usually that's what's going on in most cases. So I think that the biggest difference is that we're tracking everything like a hawk.
Yeah, that tracking like a hawk is correct. Like after you put the pellets in me, I usually go get my lab work in 6 weeks.
6 weeks.
And then you do track it like a hawk. And what I love about you is that you actually get back to me. Yeah. And will give me a copy of my lab work if I want it.
You can have anything you want. It's all yours.
It's all mine. I paid for it.
Yeah.
I own it.
Yeah.
I just can't, you can't share it with people unless I tell you to.
Yeah.
Yeah. So, those are the laws. We'll get into that. A lot of people, when they talk about hormone replacement therapy, or I talk to them about it, they're worried about, is it messing with other things in the body? So does hormone replacement therapy, if people do it for a little bit and then stop, what are the negatives to that?
So this is kind of the analogy I was making with the arm and the cast. If you do it for a few months and stop, probably nothing. You know, probably you'll probably just bounce back to wherever you would have been. If you push that off, there is a point, at some point, where you're never going to bounce back fully, right? There is a point at which that left arm is never going to be fully functional like your right arm again, whether it's decreased range of motion or strength or whatever. Same thing with your testicles. If you give them a break long enough, they're going to have a hard time bouncing back. I can't tell you exactly what that number is because it's different for everyone. It's probably somewhere between 1 and 2 years before you have some sort of permanent dysfunction. That being said, if your testosterone is like 150 as a male, it's kind of like you're not making testosterone anyways, to be perfectly honest.
So we'll just get back to the point where we were before we started there.
Yeah, even if you drop down to 100 or 70, it makes no having 70 or having 150, you're gonna feel the same.
Like shit.
And for perspective, a typical male range is 300 to about 900 or 1,000. Do I see a lot of guys around 1,000 these days? No. And actually, and this is kind of a fun topic to talk about, my older patients have higher testosterone than my younger patients. And the question is like, of course, why? I think it's multifactorial. I think it's the foods we're eating. I think it's the type of work that we do and the toxins that we're exposed to. Plastics is probably a big part of this. I think her name is Shauna Swan. She's been on everyone's podcast, Joe Rogan. She has a book called Countdown. It talks a lot about like fertility in men and women, testosterone in men, and exposure to phthalates with a P, plastics. Pretty freaking amazing. There are some people that kind of oppose her ideas, but it's a really good, interesting read. If you don't want to read the book, go listen to her podcast on Joe Rogan. She makes some good arguments. Long-term exposure, especially exposure in utero, exposure as a young person to these plastics is going to decrease your the function of your sperm, decrease your sperm count, decrease your testosterone, and just it makes men more like women and women more like men. These plastics are what we call xenoestrogens, meaning they look like estrogen and they fire your estrogen receptors even though they're not actually estrogen. So I think these toxin exposures is a big part of it. I think the type of work that we do, we're not doing much manual labor. We're sitting down at computers, staring at screens all day. I think that over the course of 30, 40 years of working is going to limit your testosterone production. So we said and the foods that we eat. We're probably eating way too much and living way too sedentary of a life to have higher testosterone. So I would say my average 50-year-old or 60-year-old man has higher testosterone than my average 30-year-old man, which is crazy.
That's awesome. So I have something to look forward to, I hope.
Yeah.
I hope. So when you talk about testosterone and hormone replacement therapy in men and women,
Yeah.
does it interact with any of the other important hormones like thyroid?
It depends who you ask. I think not a lot. That being said, if I use testosterone as a tool to help you get into shape, to help you go to the gym every day, to drive you to, work better, work out harder, live a better quality of life, have better relationships, then yes, it's going to affect all those things. Your thyroid, everything is going to be affected. But just giving you testosterone in and of itself, I don't think is going to affect your thyroid much.
How about if someone lives a very stressful lifestyle? Because life is stressful.
Mm-hmm.
How does cortisol interact with testosterone and estrogen?
Good question. So cortisol is actually made in this same pathway that testosterone is made, right? And these substrates that you're using to make cortisol, if you're pumping out cortisol because you're high stress all the time, then you're going to have less of this substrate left over to make your testosterone, right? So a lot of these supplements, these over-the-counter supplements that are T boosters, testosterone boosters, you could really market the exact same ingredients as cortisol calming agents.
Cortisol inhibitors.
Yes, cortisol inhibitors. So what they're doing is basically trying to decrease the production of cortisol to leave more substrate to make your testosterone.
How about alcohol? How does that interfere with estrogen and testosterone?
Alcohol is one of the things that interferes with everything negatively, unfortunately. I think moderation is probably fine. I know a lot of people these days will argue against that. A lot of the Andrew Huberman followers will say no drinks. And he's probably right in that even one drink is negatively impacting you. I just don't know if it's enough to make a difference, to be honest.
Nicotine.
This is a contentious point right now. This is one of those topics. I think nicotine is one. I think the other one is like dietary cholesterol and whether it affects your serum cholesterol. I think these two topics, whatever you say, you're going to have like the mob go against you on the internet. Nicotine has some benefits for sure.
It makes you mentally sharper.
For sure.
Yes.
For sure. For a limited period of time.
Mm-hmm.
And you get addicted to it.
Correct.
And when you don't have it, you feel the opposite effects now because you have that withdrawal effect, right?
Correct.
So is that a good thing or a bad thing? Maybe if you need it for like a moment of the day every day, then it makes sense. But I wouldn't use it as something to like make you sharper for the entirety of the day because you can't keep doing that. It's like trying to drink coffee all day or something. It won't work.
Does nicotine, though, interfere with testosterone and estrogen?
Nicotine is a vasoconstrictor. I know there's a lot of times that we don't want you to have any nicotine, especially after surgery when you're trying to heal and stuff like that. I don't think I've seen a lot of evidence pointing to interference.
Okay, now that's getting legalized. We got to ask about cannabis.
Yeah.
Is there a lot of research being done with how cannabis is interfering with our hormones, testosterone, estrogen?
Yeah, I think a lot of it has been done. Even as a little kid, I remember learning about this, and I don't know, maybe they were trying to scare us because we were little kids, but marijuana, cannabis, whatever. I think you can tell how old someone is by what they call it now. I think younger people call it cannabis.
Yeah.
Yeah.
Mary J.
Yeah.
We have all the names.
I think it does increase your estrogen with time.
It does.
Yeah, I think it does.
Someone calls you and says, okay, now I'm interested in hormone replacement therapy,
Mm-hmm.
but they're scared.
Mm-hmm.
How do you relieve their fears?
I mean, I think having that 30-minute appointment where we're just kind of talking about things does a lot. I'm not a pushy person. I don't want you to be on testosterone or estrogen if you don't want it. So most of my patients have already kind of decided, and I'm not going to be the person. I'm not going to be the person to push you over the edge. But if you want to, maybe like let's say we're talking about pellets. It's 4 months of therapy in a pellet. It's really awesome. I love it for a lot of reasons. I think pellets are kind of the Rolls Royce of hormone therapy. But if you're scared to commit to that 4 months, I can give you a shot that gives you a week of therapy in my office. You maybe come back next week, do one more shot, see how those 2 weeks felt.
So let's go over the different ways of delivery of testosterone.
Yeah.
You keep mentioning pellets.
Yeah.
And we'll go over how those are done.
Mm-hmm.
But there's pellets, shots, there's lotions.
Mm-hmm.
Is there any others that I'm missing?
Oral.
Mm-hmm. Which has the most side effects?
Probably the topicals, I would say.
The topicals?
Yeah, the old orals were...
Winstrol?
The old orals were really bad.
Liver failure.
Yeah. So there is a new one that just came out on the market that avoids that. I think it's like 2 pills 3 times a day, 2 capsules 3 times a day. I don't love stuff that hasn't been used for a long time either. So I don't use it in my practice. I'm kind of waiting a couple more years to see how this goes before I introduce it to my practice. It's really new. So that's out there. It seems to be safe for the liver though, which is great. The topicals for someone who's deathly afraid of shots or pellets or something like that, is a good option, but it has a lot of kind of drawbacks. Depending on, is your skin warm? Is your skin cold? Did you just take a shower? Where are you applying it on your skin? Do you have pets or children or partners that are in contact with you? Because they will get it on them. I've heard of pets losing fur on certain like parts of their body. I don't know if you've ever seen this.
I had a dog go
Yeah.
into heat because she was licking her owner's
Yeah.
estrogen
Yeah.
cream on her skin.
Yeah, yeah, exactly. So, so that same thing goes on with kids. So if you have kids around you, you probably want to avoid that. And if you have a partner touching you, which if you're on hormones, you probably are trying to have your partner touching you. It's not the best choice. It's also notoriously hard to measure in serum, in blood. It goes from the skin, through the skin, into the blood, and then into the tissue very quickly. And we're checking it in the blood. So you check and it looks low when in fact it's actually high. And a lot of kind of the newer doctors in this field will start giving you more and more until you get that higher number, and then you have way too much.
Because it gets stored in the tissue.
Yes.
So as your blood levels drop, it comes out of storage and it will continuously go in.
It's built up in your tissue now, but
Yeah.
you just, it's the blood is just the pathway that it takes to get there, right?
Right.
And we're measuring in the blood because we don't want to do a tissue biopsy or something, right?
Right.
So I think it's probably my least favorite is probably the topicals.
And now the shots. I remember the shots used to be an inch needle, very thick, oil-based, into the butt.
Inch and a half.
Into
Yeah.
your leg, into
Yeah.
your rear end, your butt muscle. Is that still the case?
Yeah, and it had to be a big it had to be a big gauge, a large gauge
because the oil was so thick.
Yeah. So typically speaking, that is still the process. We do have access to testosterone and MCT oil now, which is a much thinner oil, and you can inject it with using a smaller gauge needle. And although testosterone has always been like an intramuscular injection, meaning it had to go deep into the muscle, we're finding that a lot of people are injecting it subcutaneously into the fat with a much shorter needle and doing just fine. It seems to slow down the process of breaking it down when it's in the fat as opposed to when it's in the muscle, probably because you have less blood flowing in the area. But if you're doing like a twice a week injection, which I always recommend anyways, I don't like the once a week. Some people do like once every 10 days or even 2 weeks, which is crazy to me because you're going up so high and crashing so low before your next injection. So if you're doing it twice a week subcutaneously, should be totally fine. And that is, for that reason, probably my second favorite option. Pellet,
Do you get injection site reactions ever?
yeah, and you always can. Yeah, especially even if you don't inject anything, if you're poking in the same area multiple times a week, you can get those arthritis reactions kind of.
Okay.
It almost looks infected. It's like red, swollen, lumpy area.
Painful.
Yeah.
Yeah. Now let's go over the pellets.
Sure, yeah. So the pellets are my favorite for a few reasons. First of all, it comes in what we call the bioidentical form, meaning the molecular structure of this testosterone is exactly the same as the testosterone that your body has always made and always used. There's no difference. Your body can't tell a difference. There's no leftover gunk. There's no nothing. It's pure testosterone. When you see it in the vial, it just says testosterone. It doesn't say testosterone cypionate, testosterone enanthate, which these injectable forms
Correct.
always do, right? Sure. The injectable form, so the reason it says enanthate or cypionate is because they've changed the structure so that either it has longer like half-life once it's injected into your body or longer shelf life. It can sit in the bottle for much longer. But it's not pure testosterone anymore. So it looks enough like testosterone that it fires your receptors lock onto it, but it's like using cheap gas in your car, I always say. It has this leftover gunk, and what is that gunk doing? We're trying to figure it out right now, but a lot of research is actually pointing to the fact that some of these side effects, even things like cancer, are caused by this leftover, by this gunk. Yeah.
I mean, we're finding, it's a strong belief that all the gunk that we have in our life is what's leading to us to all these cancer diagnoses.
Yeah. So a lot of research going out. I don't know how you feel about him, but RFK is kind of getting into the nitty gritty, which I like the fact that he's looking into all these things for sure. Whether he's going to find anything, time will tell. But I like the fact that they're kind of looking into these things.
Right. Well, it depends where the money's coming from, but that's a whole different political medical show.
I always say this: if you want to find something, you'll find it. If you want me to find you research pointing to whatever you want, I will find it for you. Good quality research, and I will also find research to refute that good quality research, and it's all out there. Unfortunately.
It is. So let's go over the pellet process because that's what I've been doing.
Let me say one more thing about the pellet, and it is kind of about the process. So, Bioidentical, you have a nice even dose for 4 months, which is like spectacular. You can go live your life. You can go swimming, go on vacation, play sports, do whatever you want. You don't have to travel with anything. You have 4 months of therapy in a small incision about 1 centimeter long on your hip, and you're done. You don't have to come in for shots. You don't have to do anything. You just go live your life.
So the procedure itself, how long does it take to get the pellets installed? 15 minutes.
Probably 5 minutes.
Well,
you're nervous. It seems longer.
I'm nervous.
I'm just
nervous. I'm nervous. You local the area. You make your small incision. You put them in there.
Yeah.
You glue it shut.
Yeah.
You put a bandage on there.
Yeah.
What are the instructions going home?
If you're a guy, 5 days of taking it easy. I don't want you to work out your glutes basically for 5 days. So you can go walking, you can do upper body, pull-ups, all that stuff. But I want the incision to heal, and I don't want the pellets to work their way out for those 5 days. And no submerging in water for 5 days. For a woman, the submerging in water stays 5 days, but the workouts turn into 3 days because women have a lot less muscle and a lot more fat in their glute hip area. So the pellets almost never work their way out. Plus, it's a smaller incision, a smaller pellet. Women really win at this procedure. It's like life-changing. You put estrogen in a woman, she starts feeling it in 3 days. Her hot flashes, gone. Her irritability, gone. Mom rage, you've heard of mom rage before? Gone in 3 days.
Is that the same as wife rage?
Kind of. Yeah. It's rage in someone who's going through that kind of time in their life. It's crazy. I mean, I don't want to say I'm 100% on this, but like 90% of the time, if they're like a woman who's kind of that far deep into feeling all these symptoms, in like a week, they can't believe how much better they feel. And then the testosterone starts to kick in around day 10, and they start getting their drive, their energy, their focus, their sex drive. They're like, God, why did I wait so long? Probably the thing I hear most is, why did I wait so long?
Yeah. It kind of makes you happy, but also sad at the same time.
Yeah.
You know, it's like, it was available. And that's why we're doing what we're doing today. One of the things you get with aging is you lose your bone density.
Yeah.
Does hormone replacement therapy help with the bone density?
Such a good question. Yes, it definitely does. And so women really have to worry about osteoporosis, right? Loss of bone density much more than men. That's because women have this sharp drop in their estrogen production in menopause. They're making no estrogen. And estrogen was one of the cues telling the body to put the density into the bones. Testosterone also. There is no medication out there, even those expensive injectables, that does a better job than hormone therapy for women to keep bone density. Nothing. Plus, the side effects are that you feel good and look great. So if you're someone who has loss of bone density or, family history of that and has some of these other symptoms, it's the best thing ever. You're just hitting so many problems with one treatment. So bone density is, osteoporosis, I should say, is a debilitating disease. I mean, if you have true osteoporosis, you got to be worried about every fall, every step you take down. God forbid you fall and hit your back. It's debilitating and ends a lot of people's lives, actually.
If you have a loss of bone density, is hormone replacement therapy covered by insurance?
I don't think so.
Is hormone replacement therapy ever covered by insurance?
Yes. Typically, if you want to do like contraceptive pills type therapy, or sometimes shots, which are so cheap, it doesn't even matter. Like, you can use like GoodRx and go to Save On, and you can get shots, like the regular version of shots. I don't know, like $25 a month or something. Your copay is probably going to be that much.
Yeah, exactly. Well, yeah, you're out of pocket too. You got to start throwing that in there as well.
Yeah.
Human growth hormone.
Yeah.
Do you mess with it?
No. For a couple of reasons. One, it has drawbacks and some parts of it are scary.
What are those scary parts?
So it can grow anything in your body. So
i.e. cancer.
Cancer. Yeah. So if you have a cancer in your body, this can help it grow. It'll be feeding it, basically. Now, there are some peptides, which are kind of like a hot topic right now. And I don't even like to use the word peptides because insulin's a peptide. A lot of things are peptides.
For the listener, what exactly is a peptide?
So a peptide is a chain of amino acids. Once you pass a certain number, I think it's like 50, something around there, it becomes a protein. Less than that, it's a peptide. That's all it means. But a lot of people are figuring out that this whole section of peptides, which we weren't really giving much attention to, have a lot of interesting properties to them, right? And we have peptides, which are growth hormone secretagogues. They're basically things that help you make and produce more of your own growth hormone. It is a much softer version of actually taking growth hormone, but it also has way less side effects. And people really love it. I mean, a lot of these 55-year-old guys who are doing jiu-jitsu every day, which is a very hard sport to do into your 50s. I take a lot of these MMA guys in general. They find it helps them be able to work out every day still. Continue working out every day. Whereas before that, they had to take a couple days off every week. Now they're 5 days, rolling jiu-jitsu and 2 days lifting weights or something.
Hormone replacement therapy help at all with arthritis discomfort?
Yes, because it's a potent anti-inflammatory testosterone.
So even the older people that are having, I don't want to consider myself old, but knees, hips, lower back,
Yeah.
it can help with that as well.
Yeah, I mean, it depends on the type of arthritis, right? For sure, inflammatory arthritis, like rheumatoid arthritis, stuff like that, we see a lot of benefits with. Osteoarthritis, I see that people feel better, for sure, but that's not an inflammatory process per se. So I think you still have that bone-on-bone problem going on in those cases.
So it stops inflammation, but not so much pain or discomfort.
Yeah, I think people overall feel better, and I think they're just kind of more okay with the pain, but it's not suppressing your pain.
Well, another thing it's going to do is going to help build the muscle. So for the knee, for example, which you need all those muscles to stabilize that knee, it will help build those up as well.
Yeah, for sure.
Are there any contraindications to hormone replacement therapy?
For sure.
What are they?
We're talking men or women here?
Both.
Okay, so cancer is the big thing that you want to check off the list first, right? With women, you're talking about breast or endometrial, which is like
Uterine.
Thank you. God. I was on vacation for 10 days, man. Give me a break. And with men, you're talking about prostate cancer. Now, it's super important to know, listeners, testosterone does not cause prostate cancer, but it can feed an active prostate cancer. Estrogen does not cause breast or uterine cancer, but it can feed an active cancer. So what do? We always check first. We always do your mammograms. We always check your PSA. With women, we continue checking every so often. With men, I'm going to check your labs, your PSA every 6 months. Actually, at first, for 6 weeks, at 6 weeks, and then every few months after that. If we ever see a jump up, we'll send you to the urologist to get an exam. But as long as you're careful, I think I've probably saved more lives than hurt, because when I start someone on testosterone, I check them 6 weeks later. If they have a jump up in their PSA, we're like, hey, man, maybe you have something kind of cooking in there. Send you to the urologist. They find a really early prostate cancer, as opposed to never doing anything, waiting till it gets much worse, and then potentially having it spread. And I've had that happen a few times, actually.
What about heart disease?
So I think most of the new research, and there was actually a really good study about this recently, decreased risk with hormone therapy. Is that because people are living happier, healthier lives, or is the medicine itself decreasing the risk? I'm not sure, but the newest data is showing definite decreased risk of heart disease.
Does it lower your cholesterol?
Yes. Not at first. Testosterone will give you a jump up, especially in your triglycerides at first. But if you wait, I think the studies were done on like 18 months to 2 years, definite decreased cholesterol.
What natural supplements should they be taking if they're doing hormone replacement therapy?
I'm a big fan of something called DIM, D-I-M. DIM is in cruciferous vegetables like broccoli, cauliflower, Brussels sprouts. This is what is so, a lot of women take this who aren't even on hormone therapy because it helps them make the right types of estrogen. It's a natural blocker of the conversion from testosterone into estrogen. So if you're on testosterone, it helps you preserve your testosterone. And when you're making estrogen, because men make their estrogen out of their testosterone, it helps you make the right kind that helps you feel good.
Any new treatments that listeners should know about that are coming down the pike?
For hormones specifically,
Yeah.
those pills are a big one. I think they're probably going to get more popular as long as we don't find any devastating side effects, and as long as you're willing to take a couple pills, like I think it's 3 times a day, which seems like
Yeah, with at least Southern California lifestyle, that's kind of hard.
it's kind of hard.
Unless you just keep them in the car, right? And just
And I don't think you want to keep pills in the car.
yeah, you're going to denature them
Yeah.
by them sitting in the hot heat.
I hate having to take pills more than once a day.
Yeah, I do too.
Yeah, I got my vitamins that I take in the morning, and I have my vitamins that I take at night, and they all sit at home, so I take them.
Yeah, I'm hoping to have you back for your whole supplement thing because the one thing you did, I mean, like I said, you transformed my life.
Thank you.
But it wasn't something that happened overnight.
Mm.
What about listeners right now? If they do start hormone replacement therapy, realistically, when should they start feeling better? Of course, you said all the women in 3 days, but I'm just saying, like, realistically.
Okay, so a few things with that. First of all, the reason that you were able to kind of make that change is because you were ready to make that change. Giving someone testosterone does not change their life. Maybe you have more sex drive and you'll get a little bit stronger. But I think if you're not doing the things that you're supposed to do, if you're not working out, eating well, it's almost going to cause more harm than it is benefit at that point. Someone who's ready, like my favorite patient is someone like you. Like I love like the 55-year-old who's working out hard every day.
I'm not 55 yet.
I'm just
Okay.
I'm saying I love the 55-year-old. I said someone like you, and then I said my favorite patient is the 55-year-old who's working out really hard every day, doing all the things, eating well, and just lost a step. And like he's like, man, it's really hard for me to go to the gym every day. It's really hard for me to do these things. And you support them with some testosterone therapy, and they fly. I mean, they do so well. They're like, Doc, this is amazing. I'm stronger again. I'm healing better. I'm recovering faster. I feel sharper. I'm doing better at work. Feeling more confident in my meetings. My home life, my relationships are better. I'm just a better version of myself, right? So it's the guys that are and women who are ready to kind of tackle this are the best sort of patients. Now, how long is it going to take to actually feel better? So the form of testosterone makes a difference. If I give you pellets, it takes a couple weeks for it to even start getting into your body. If I give you shots, that timer starts as soon as I give you the shot. However, you need to let it build up in your body for a few weeks before you even feel it. So if I give you a shot and in 2 or 3 days you have a high testosterone level, it's still going to take you likely a week or two from that point to really start noticing some benefits. If I give you pellets, it takes 2 weeks to really start building up in your body, and from then on, a week or two to really start noticing the benefits.
So
sex drive, especially in women, can take 6 months.
Oh, so they have to go through a couple pellet insertions.
Sometimes that seems to take longer than everything else.
And pellets, as you said, is every 4 months.
4 months.
So that's 3 times a year. You got to do it.
Typically.
Yeah. When you talk about it taking a while, you will feel, from a personal standpoint, I felt better like within a week, like sharper. The one thing I noticed also is that when 9:30 came, I was asleep and I was out.
Oh, we didn't talk about that at all.
Yeah,
Really.
it helps with your sleep,
Yeah.
big time. But yeah, it was like I got that quicker, but the other things like the endurance, the mental fatigue, those all took a little bit longer to get over.
I think a lot of that is driven by your like hemoglobin and hematocrit, which they live about 100 days. You know, your red blood cells, they last about 100 days. So as the older ones start to die off and you start kind of making, you have more dense blood in a way. You have thicker blood. You have more hemoglobin, more hematocrit, more red blood cells in the unit area. So that's going to increase your stamina and endurance. It's just going to take about 2 months to notice it.
How long do you think it's going to take before HRT becomes part of just plain preventative aging medicine, part of the general screen?
I think we're pretty close. When I was in residency, we had to do a research project, and mine was to ask guys questions that had to do with kind of sex drive and testosterone-driven questions, and I kind of got laughed at for doing this. They're like, "Oh, this isn't part of the screening." Like one of my attendings was pretty rude about it, to be perfectly frank. He's like, this isn't part of normal screening. We shouldn't be doing this, and I'm not going to do it. Okay, fine. But all these people are going to benefit from it, and by not doing it, you're kind of hurting them in a way. You're limiting their quality of life by not asking them these questions. I think we're getting pretty close. Unfortunately, things even in medicine are often driven by money, as you know. So until like people are getting paid more to do it, things don't change that much. I hate to say it.
Is there another hormone that is going to be looked at, you think, in the near future?
There are a lot. If you get into the nitty-gritty of this, there are a lot. Cortisol, people have been looking at for a long time. Growth hormone, obviously. Is there like a sneaky one that I can kind of give you something about? I don't think so. Well, I mean, the hunger ones are a big one as well, right? And we can talk about that sometime as well. But the hunger hormones and the GLP-1s and how they block those messages, those signals, is probably a, I don't know, $50 billion point to make here. I don't know how
Eli
much
Lilly's stock is doing quite well.
They just came out with an oral form, I think, of the GLP-1, so they jumped up again.
Yeah, they did. They're available in Mexico as well, just so you know.
Okay.
But yeah, I'm hoping to have you on. I hope to do a series. I love to talk about natural supplements because you and I go back and forth on that. Mm-hmm. The problem with natural supplements, in my opinion, is that there's no money in them. So the research there's some research on some, but there's not research on all. I would love to talk to you about the Ozempic, trizepatide, and all those things. I'd love to talk to you because you've gotten into hair replacement. But as I told you, God only selects very few to have good-looking bald heads, and I'm one of them. So I won't be a client there.
Lucky guy.
But I hope to have you on because there's a lot. What I love about your practice, what I love about seeing you as my main physician, is that you are ahead of the game, right? You think like I did in medicine. You want to be ahead. You don't want to be one of the followers. You want to see where it goes. And I think that for me is very important. I hope the listeners at least understand that, medicine is evolving continuously. And if your doctor really doesn't want to talk to you about hormone replacement therapy or doesn't want to check testosterone and estrogen levels on an annual basis, at least when you do your annual lab work, then maybe you should be going to get a second opinion somewhere. I'm not saying that person is not a good, phenomenal doctor. I'm just saying there's other ways to look at different things in medicine. There's no one's perfected medicine yet, right?
I couldn't agree more. Thank you for the kind words. I do try really hard to stay ahead. I go to the conferences. I read a lot. I learn a lot. Like I said, most of what I do, I learned after my training kind of on my own or, through different programs. I've been a teacher for a while in terms of like the hormones and the hormone pellets. We used to do a class every 6 weeks at my office. I worked for a pellet company where I taught 10 other doctors how to do hormone pellets every 6 weeks. I stopped doing that because I didn't want to spend my Saturdays away from my family anymore. But I did love doing it, and I love teaching in general. As far as, kind of like what you said, I do think something that I am particularly good at, if I can talk about myself for a second,
Absolutely.
is having my finger on the pulse. I feel like I know it's kind of a two-part game. You have to know what is going to be hot, but also what's not going to be BS. When you go to these conferences, I don't want to name the specific conferences because what I'm going to say is not that nice. But a lot of these kind of like integrative, and this is why people think integrative medicine is hocus pocus or wacky.
Correct.
When you go to these conferences, anti-aging, integrative, functional, whatever, they have all these booths where they're trying to sell you all this stuff. I think a conservative estimate is saying 75% is bullshit.
No, it is bullshit.
Yeah.
Yeah, and that's what I loved about you is that the first appointment, you and I were cut through what is bullshit and what isn't immediately. And a lot of people don't realize that takes a special type of medically trained person to be able to realize what truly is bullshit, because you're looking like 3 steps ahead. Like,
I'm not always sure either. Like I look at this, I'm like, man, is this good? I don't know. Like I'm not always sure, but
you think about it.
Yeah, a lot.
Right? You don't oh yeah, that's great. Let me bring that into the practice, right?
Yeah.
You think 3 steps ahead. You playing the chess game that is medicine.
Mm-hmm.
You're not playing checkers.
Mm-hmm.
Right?
Yeah.
And that's what I truly appreciated about you.
Thank you.
So if people want to look you up online, where should they go?
TrueMD.com. On Instagram, we are at it's TRUMD. And on Instagram, it's at TRU_MD. I think TikTok is the same, and I think Facebook's the same, but it might just be TRUMD. Or you can call the office, text the office, 949-922-3554.
And you're located on Old Newport Boulevard in Newport Beach, California, near Hoag Hospital. Anyone, if you have any questions, please put them down in the chats. Put them in, DM them. We will make sure that Dr. Setarah gets them, and we'll maybe be able to answer more questions in upcoming episodes as well. Because, like I said, I do not want this to be our only chat.
Yeah, I would love to keep doing this. If the listeners want like specific topics, we can go over that.
Absolutely. So, well, thank you all for listening, and we'll catch you all next time here on Truth on Tilt.